Hi, this is Marjorie Morrison.
And this is Patrick Kennedy.
Welcome to the Psych Hub podcast, The Future of Mental Health. I'd like to introduce you to the co-founder of Psych Hub, one of the most amazing mental health advocates in the world, a man who truly uses his voice to help others, uses his own personal story to make other people feel comfortable sharing theirs, a man who has tirelessly advocated for mental health, better addiction, wrote the Mental Health Parity Act in Congress, and continues to find new ways to break new grounds and have new beginnings. I couldn't ask for a better business partner and co-host of this podcast. Please meet Patrick Kennedy.
Thank you so much, Marjorie. It's great to work with you on this important mission, a mission of helping to bring greater understanding to brain illnesses and how to best navigate them, and the work that we're doing at Psych Hub to bring greater literacy to those that treat those with mental illness and addiction, and educate their family members, their friends, and most importantly, their providers to ensure that when they are seeking treatment, they get the best treatment available. I am a person who lives in long-term recovery. That for me means that I have not had to drink or drug since February 22nd, 2011. I grew up in an alcoholic home. I grew up in a home where my parents had suffered from severe trauma. A number of my family members in my father's generation died very violent deaths. My uncle Joe was killed in World War II. My uncle Robert Kennedy and my uncle John Kennedy were both assassinated. My aunt Rosemary was subjected to a lobotomy, which at the time was considered the evidence form of treatment for her psychiatric illness. She then became an inspiration to my aunt Eunice Shriver, who started the Special Olympics program, which is now in 190 countries around the world. I have been walking in some big shoes my whole life. I have really only learned about my mother's side of the family after I wrote my book, A Common Struggle. When I really researched her family history, I learned that my grandmother on my mom's side of the family died of alcoholism and was really not found for several days because, like in most cases, people with this illness isolate. She had already been divorced from my grandfather, which back in the 50s was really unheard of. My aunt Candy is also in recovery. She wouldn't mind me saying that because she's very public in her advocacy. And I have many cousins who also are in recovery. I really feel as if I've been blessed in my life to have an opportunity to live my recovery in a very public way. This is kind of contrary to what most people experience, where they live with anonymity. And that's really one of the spiritual principles of recovery. In my case, I couldn't live with anonymity. My disease essentially outed me. I had been to rehab at 17 for addiction to cocaine and pills. And what I found was that the fellow that I was in treatment with decided to tell on me, having been in treatment, although I'd wanted it to be a secret. And he sold his story about being in a rehab with the Kennedy to the National Enquirer. I had entered politics just before that, and I'd thought that my political career was now over as a result of that. And I was very heartened to find out that instead of being over, it was just beginning. My constituency reelected me overwhelmingly. I went on to serve in the House of Representatives, the United States House of Representatives, where I got to be the primary sponsor, along with Republican Representative Jim Ramstad, of the Mental Health Parity and Addiction Equity Act, which was a modern day medical civil rights act that essentially said you had to treat illnesses of the brain like any other set of illnesses. In other words, you couldn't have higher deductibles, higher premiums, lower lifetime caps for coverage. You could not have limited access to treatments, whether those treatments were primary care, secondary care, tertiary care. In other words, that the whole spectrum of treatment need to be covered, much like you would expect in the treatment of cancer, cardiovascular disease, or diabetes. And what we found is that it was a very big lift to get something as simple as passing a bill that said you could not discriminate when it came to ensuring coverage for brain illnesses. And the stigma around these illnesses was so great that it really impeded the political support for this bill. Ultimately, we were able to get the bill passed, really not because of any outcry from families across the country or patients across the country, but because I knew somebody, namely my dad, who was a very powerful United States Senator, Senator Edward M. Kennedy of Massachusetts, who knew somebody important, and that was his best friend in the Senate, Chris Dodd, senator from Connecticut, who, in addition to serving with my dad on the health committee, also was chairman of the banking committee. And we passed this bill in 2008 during the great economic upheaval and collapse of our banks. And the way we passed it is that Chris Dodd wrote the whole Economic Stabilization Act to bring our country back from the point of an economic depression. At least that was where we were heading, given the limited credit that was out there and the fact that our economy was shrinking very fast. And we got the parity bill passed, the House version, HR 1424, because Chris Dodd guaranteed it by writing this essential bill into our bill, therefore guaranteeing that it would be passed. And I always say that it's kind of ironic that the bill that was to address our economic depression was the bill that mandated coverage for depression. And the bill was signed into law by President George W. Bush on the same desk as my uncle, President Kennedy, signed the Community Mental Health Act of 1963. And ironically, when I wrote my book, A Common Struggle, I looked back at President Kennedy's early work in this. And in the signing ceremony for the Community Mental Health Act of 1963, which was the last bill that John F. Kennedy signed before he was killed, he said, people with mental illness, quote, need no longer be alien to our affections or beyond the help of our communities. And I thought that that simple statement really encapsulated the fight for what we really wanted. We didn't want to be alien to the affections of our family, friends, our community, which of course is what we are, those of us who have suffered from these illnesses. And we don't want to be treated just by psychiatric hospitals and psychiatrists and treated with medication. And President Kennedy didn't say any of those things. He said in our communities, and he really revealed what the goal is. And the goal is, yes, we might need professional medical support and medication, but the real optimal recovery takes place in communities with supportive housing, supportive employment, peer support. And the excitement I have around starting Psych Hub with you, Marjorie, is that we have an opportunity to really spell out how that policy is delineated in all of its manner of being, meaning we would be able to better help the world understand that if we provide the same type of home and community-based care that we expect for our seniors or people with, frankly, intellectual disabilities, we would create a reimbursement system that incentivizes people living optimally at their greatest capability. In other words, free of the burden of both the physical dependence on drugs and alcohol and free of the obsession and compulsion to use drugs and alcohol in order to medicate, and the freedom to live in a socially integrated way such that people will not feel isolated, which is one of the prime characteristics of people who suffer from both addiction and mental illness, which, by the way, is the same. We use those terms just to give a better appreciation to the world, what we're talking about. But in essence, addiction is a mental illness. So what I'm really excited about, as well as creating these micro videos and helping people access better knowledge about their illness, and therapists and providers having better understanding as to how to best treat these illnesses, and better kind of social supports and family and friends better being able to know where their role is in helping their loved ones with these illnesses, and better public policy for those who are in positions of authority to know how to better create a system of care with appropriate reimbursements so that we get the system we need. So, a lot of this started for me when I created the Kennedy Forum, which was started on the 50th anniversary of my uncle signing the original Community Mental Health Act. And over the years, the Kennedy Forum has convened the experts in the space and really helped, coalesce and curate all of the knowledge that was out there around public policy in this area. Because when I was in Congress, I found there wasn't a place that really captured the whole roadmap, if you will, to helping people in recovery and making sure that we incentivized prevention in addition to treatment, and then to really introduce recovery, which is a concept that's still very foreign to many in the medical field who still treat these illnesses as acute episodic events. So there's just a watershed moment right now with COVID, with the need for us to build out much broader access for evidence-based treatments. And the Kennedy Forum led me on a journey that helped me come in contact with you, Marjorie, through PsychArmor. It was a real perfect synergy in both of our experiences to come up with a process where we could take the policy, we could take the template that you had created through PsychArmor, and was very well received as an important tool for businesses to know how to best be sensitive to the needs of our returning veterans after Iraq and Afghanistan, and take that, educational toolbox and make it more widely available to the mental health world around these broader issues, just like you had done in the veteran space. And I think there's no accidents in this world. I really feel like we're at a time and a place where we were meant to be, and that this company called PsychHub and this podcast will help further the mission, both of our missions for our lifetimes, and introduce the world to all of those who we've come across in this crusade, who are in the trenches with us, fighting to expand coverage and to end discrimination against those who suffer from these illnesses. So I am thrilled to join you and to invite people to follow us in this podcast and to hear really the benefit that I've had from meeting really extraordinary people, having been kind of blessed to have a front row seat to seeing all the exciting things that are going on in this space, and that I hope that when people listen to our podcast, that they'll catch the fever, really get fired up, find new ways to be involved themselves if this is an issue they care about, learn kind of the language of how we can speak about these issues in a way that invites others to tell their own stories and change the attitudes towards people who suffer from these illnesses, and really change this current epidemic within a pandemic of overdose and suicide into a fundamental watershed moment where we muster the political resolve to not allow this to continue, where we show people that a solution is possible if we only apply our political will to making it happen, so that future generations, our children, your children, Marjorie, the people who are listening, my own 5 children, do not have to have the difficulty accessing care that people today have difficulty in accessing, and that we expect high standards and great outcomes from a part of our healthcare system that is really underdeveloped, but through efforts like PsychHub, the Kennedy Forum, and others, we can help change. And so it's great to be launching this with you. And I know we have a number of really exciting episodes in store for people who are listening.
Thank you, Patrick. This has been such an incredible journey being on this PsychHub mission with you. I love learning alongside you. You are a wealth of information, and every day I feel grateful that we get to do this work together. Like you, I'm on a mission to bring greater understanding and literacy to a space that needs to be transformed to better deliver care to all of us that need it. I often think about how in the world I ended up here. I'm a therapist by training, but frankly, I've been in this space all my life. Mental health has been a part of my life as long as I can remember. My father was a psychiatrist, and when all my friends had what felt like normal childhoods, I grew up having family meetings every week where we would talk about our feelings. 4 kids, 3 of us girls, you better believe there were lots of feelings to discuss. When I was in 5th grade and I still hadn't memorized my multiplication tables, my dad hypnotized me. In high school, when I couldn't sleep, he taught me how to meditate and journal. In college, when my peers joined sororities and fraternities, I joined the hotline and spent my weekends manning the phones, talking to people in crisis. Everyone thought it was weird, but for some reason I loved it. I got my graduate degree in counseling psychology and spent my early training years at Children's Hospital in San Diego, collaborating with the school system and working with at-risk kids. I spent a few years doing home visits with families who were in such distress, they couldn't even make it in the office. It was hard. I saw a lot of child molest, a lot of abuse. I often had to have kids removed from their parents and put into the foster system. I had death threats on me. I stopped being able to sleep. My dad's meditation and journal tricks no longer worked. He had to switch me over to Ambien. When I got pregnant with my 3rd child, I decided to go into private practice. I then spent a decade working with adults, couples, kids, and adolescents. It was a great experience. I learned a tremendous amount about people and the common struggles we all face. As my practice got busier, I stopped taking insurance and went private pay only. The upside was my clients were relatively healthy, and so they were really working on being the best people they could be. But the downside was the problem started to feel superficial. I was really only seeing clients that could afford to pay, so it was a skewed population. In 2008, I decided to take an opportunity to work at the Marine Corps Recruit Depot. This is boot camp for west of the Mississippi. It was the height of the wars in Iraq and Afghanistan, and I was so excited to help the soldiers. I knew nothing about the population. I didn't even know that Marines weren't soldiers. Turns out they're just Marines. Growing up Jewish in Los Angeles, I knew nothing about the military, but yet the arrogant side of me thought I could help them. Turned out the Marines helped me a lot more. I learned firsthand about this incredible culture. I used to feel sorry for them. I don't know. I used to think that the only people that joined the military were ones that had no other options. I was so wrong. These were people that loved our country and they would die fighting for it. I was working with drill instructors at the time, and in order to be a drill instructor, you had to have multiple deployments. So needless to say, this was an at-risk group. The military mental health services were completely broken. But lucky for me, the leadership was innovative, and for whatever the reason, they trusted me. Together, we rolled out a proactive counseling program, a revolutionary approach which brought mental health screening and counseling to every drill instructor without them having to seek it. Developing that program was one of the greatest gifts I've done in my career. I got the opportunity to scale the program at Camp Pendleton, and I got to work with the greater infantry population. But the deeper I got into the work, the more I understood how big the problem was, and that part of it was that if only 1% of our country is serving and 10% are military connected or veterans, it leaves 90% of the population people like me, civilians who have no idea about this culture. So different than back in the day when there was a draft. But yet, when these service members leave the military, if they go back to school, we're their teachers. If they get civilian jobs, we're their employers. If they use their commercial health benefits, we're their doctors. If they use nonprofits, we're their volunteers. So I founded PsychArmor Institute, a nonprofit online education organization to train civilians on how to treat and support military veterans. Life is such a journey. You never know what each experience will bring. Through my time at PsychArmor, I had the opportunity to train community mental health providers on evidence-based interventions for treating PTSD and traumatic brain injuries. Patrick and I had been colleagues, both advocating for early intervention and quality mental health care, and decided to start PsychHub, an online platform for mental health, substance use, and suicide prevention education. We train mental health providers on evidence-based practice with an overall goal of moving them from generals to specialists. We also have a free library of over 200 short animated videos on these topics, and you can find them on our YouTube channel. And we recently launched our Mental Health Ally certification, designed for anyone who wants to learn the critical knowledge and skills to help those around them. As much as things are getting better in mental health regarding stigma and open conversations, the system is broken, truly broken. But we can't fix it without figuring out and executing on what needs to change. This podcast is focused on talking to the experts, the executives, the advocates, and those empowered to make those needed changes. We're going to learn together on what we need to do to shape the future of mental health. Nothing is off limits on the PsychHub podcast. You're going to hear raw, personal experiences with mental health. You're going to hear from leaders at major healthcare companies, celebrities, and policymakers who show us firsthand that mental health is part of everyone's life, and its issues show up in every system that exists. We challenge people to explore what needs to change. Our guest lineup is amazing. You can learn more about the upcoming episodes on our website at psychhub.com, PSYCHHUB. Episodes will release every Wednesday. You can find us on all platforms where you listen to podcasts: Apple, iHeart, Spotify, Google, Stitcher, Amazon. And if you prefer to watch us in person, you'll find the exclusive video version on YouTube. We put a lot of thought into this, but we want to hear from you. Any thoughts, opinions, ideas, feedback, please send them our way. You can reach us via email at podcasts@psychhub.com. By listening and subscribing, you've already made the best commitment you can to the future of mental health. Together, we will find and achieve the system we all deserve. As always, thank you for listening to our podcast.
If you enjoyed the show, drop us a review.
If you haven't already, subscribe to our podcast for the latest episodes.
For the latest insights, check us out at psychhub.com.